everyone, it's Lisa here with Hope for SCD. Time for another clinical trial education day in our quest to get to World Sickle Cell Day, which is June 19th. And today's trial is functional MRI parameters in sickle cell disease. This is based up in New York City, and the sponsor and collaborator, they're actually the same group this time, I know it's not the NIH, is the Albert Einstein College of Medicine based out of Yeshiva University in New York City. So this group is actually trying to study specifically adults, ages 18 through 55. Both genders can apply, and any variation of sickle cell disease is acceptable. Exclusions are if you've had any type of central nervous system complications in the past. So if you're one of those people living with sickle cell that has had a history of strokes, whether they be silent or obvious, whether they were 20 years in the past, doesn't matter. If you've had any type of stroke, you're excluded. If you are in a group that has seizures, if you've had a major head trauma, the other thing that excludes you is if you're on blood thinners, because they're trying to measure the speed of your blood flow. There's a couple of others that I didn't list on here that were more specific. You'll want to check out the link I posted in the comments below to take you over to where I got all the information. You can see the exclusions of who cannot participate and what they're trying to do, and I'll just read you the objective and then I'll kind of translate that because it's really technical. To determine baseline norms for sickle cell patients without stroke risk, to identify baseline norms of inflammation markers for sickle cell patients without symptoms of CNS complications. Okay. So what does that mean? So right now, parameters based on when to be concerned and when not, and things that might predict a stroke in sickle cell are all based on other illnesses and other better researched and more documented things of when stroke happens, or just based on healthy people having strokes. There's all kind of variations, but there's no actual parameters just specifically for sickle cell patients. So what they're trying to study is the people that have never had a stroke. They're trying to get a baseline so they can gather all this information for adults between the ages of 18 and 55 that don't have a history and just kind of see, okay, here's where the average person living with sickle cell kind of lies for MRI parameters when they're, in their healthy state or their normal state, and they can kind of see, here's the high, here's the low, and anything that would go outside of those parameters, specifically with sickle cell, would then be a cause for concern. The other thing that they're trying to see is what the baseline for inflammation markers are for sickle cell. So why would they be concerned about that? So the interesting thing about sickle cell is it's what's called a vascular disease, in that vascular means it affects your blood vessels. And so obviously, since all of those red blood cells are flowing through all the different blood vessels in your body, that makes it a vascular disease. And so when the sickle cells are forming and distorting, those little pointy sides and those malformed sides, every time they bump the endothelium, which is the inside part of any of the blood vessels, every time they bump it, it causes kind of an inflammation reaction. So almost like when I bump the outside of my leg, it gets a little red and puffy. Well, that happens on the inside of your blood vessels as well, and that shows up when they take your blood. And they get what's called inflammation markers. And so they're trying to see what's the baseline overall, just kind of getting some trends for adults without any central nervous system complications living with sickle cell. What are those baseline inflammation markers? Okay, so now that we understand what the trial is, what are they going to do to you? So this one is also another MRI one, so you don't want to be claustrophobic because they're going to stick you in that big dome that we talked about before. It's kind of with the loud knocking. To scan your brain, and then they're also going to draw some blood to see what the inflammation markers are when you're in your baseline kind of healthy state within your sickle cell progression. So the contact for this one is Dr. Billet, and his phone number is 718-430-2186, and I also put his email down below. And although it's in New York City, it wasn't specific as to how you got involved and whether or not you had to be part of their patient population or if you could be near New York City, because with you guys on the East Coast, you have so many states that are so close together. So if you're interested, feel free to go ahead and contact Dr. Billet, and we will move forward. So this one was functional MRI parameters in adults living with sickle cell. Stay tuned for another video. Thanks.